Hi, welcome to Windsor Dermatology's Healthy Skin Highlights. Can everybody hear me okay? Can everyone give me a thumbs up? Okay. If this is your first time with us, thank you for joining. If you are a returning audience, thank you again for coming back. If you want a chance to win a custom mug full of goodies, drop your name and your number in the chat below. It's a random, we will pick a random winner tomorrow and inform that person. Okay, tonight's topic is going to be CoolSculpting. Tonight is our third lecture of a 14-lecture series. Throughout our educational lecture series, the providers at Windsor Dermatology will discuss multiple different and common dermatological conditions. Tonight, it is my pleasure to present Dr. Wendy Myers. Dr. Myers is a well-versed in all areas of dermatology and serves as the director of CoolSculpting here at Windsor Derm. She is the chief resident during her dermatological residency at the University of Vermont. Furthermore, Dr. Myers is also a member of the American Academy of Dermatology and Women's Dermatological Society. There will be time at the end of the presentation for questions, so if you have any, please drop them. It is now my pleasure to introduce Dr. Wendy Myers for our CoolSculpting Healthy Skin Highlights.
Thank you. I'll give you that. All right. Aha, here I am. Hi, everyone. I'm happy to be here tonight to talk about CoolSculpting. I swear this is the second time I've done a Zoom call, so please have mercy on me that I am not good at this, okay? But let's get rolling. So CoolSculpting. So what is it? I need my assistants to help me like advance the screen. Sorry guys, again, I'm a newbie. Technical difficulties, of course. Just all right. Thank you very much. All right. So what is CoolSculpting? CoolSculpting is a non-invasive fat reduction treatment, both for men and women who are really trying to target and get rid of these unwanted pockets of fat that no matter what they've done, they don't like to go. CoolSculpting has been around for a number of years. It's going to be a decade soon where it's been FDA approved. It's clinically proven to work. One of my favorite aspects of CoolSculpting is that there is no downtime. So I think that for most people, we don't have the ability to take time off to do procedures like this, and CoolSculpting is going to provide that for you. Because of the no downtime, you can kind of allude that no needles, no cutting, no surgery. So you're going to get this procedure done and walk home that night and go to the gym and do what you need to do with your family, which I think is a great perk of CoolSculpting. No special diets are required afterwards. We just ask people to be healthy, you know, exercise, eat well. So why do we freeze fat? So these really smart guys at Harvard back in the 70s, Dr. Manstein and Anderson, made this observation that kids that were teething were getting like these little divots in their cheeks because they were sucking on ice pops, and those ice pops were like literally freezing the fat in their cheeks, and they were getting like these little puckers. So these guys, really smart guys, were like, well, maybe we can use this in a way that we can actually freeze fat in a way that we want to. And here you go. Now you got CoolSculpting. Obviously, a lot of science had to happen before that because we needed to figure out a way to freeze the fat cells but not harm any of the surrounding tissue. So many years later, and a lot of studying and perfecting, and now we have CoolSculpting. So how does it work? So picture number one here, pocket of fat that no matter what you've been doing, you can't get it to go away. With CoolSculpting, there's the science is cryolipolysis. So we're able to freeze fat. Fat's very temperature sensitive versus the other tissues. So we can freeze those fat cells, they die. Your body knows any cell that's dead shouldn't be there, and it sends off these signals, come get me, break me down. So your body comes in and does that. Usually takes about 12 weeks to see the full difference. And with CoolSculpting, you're going to see that you're going to get about 20 to 25% reduction with each of your treatments. And what I think the picture is good at diagramming is not that the fat cells are smaller, but you have less. So you're actually killing cells. So when you're done with your treatment, you have less cells there that in the future can't expand, which is what's going to give you long lasting results. So important. I like this picture. So this is kind of what happens when you diet and what happens when you get CoolSculpting. So when you diet, you'll see on the side with, it says after weight loss, the number of cells is still the same as the patient in the middle. It's just they shrunk in size. So they're not as full as they once were. And when you gain weight, that same thing happens. You didn't increase the number of cells that you're getting. They're getting bigger. With CoolSculpting, you'll see that actually there are less cells after your treatment. So the areas that you didn't treat will stay the same. Nothing's affected because you didn't treat those areas and it wasn't that you were on a diet. But those areas that we did treat, you're going to have 20 to 25% less cells that also in the future aren't able to fill up with fat because they're not there. So one of the reasons why CoolSculpting gives you long lasting results. So back to that picture too, people always ask, well, how long does this last? So once you hit adolescence, I'm going to say like late teens or so, the number of fat cells that you were ever going to have in your life is there. And when you gain weight, it's because the size of them was getting filled up more. You weren't getting more cells, you were just filling them up more. So if we're able to get these cells destroyed with cryolipolysis, with CoolSculpting, then they can't fill up with fat again down the line. So yes, these are long-term results. It does require though that you live a healthy life. So if you take in more calories than you put out, that's going to mean you're going to gain weight. But the areas that we treated, because there are less cells there, you probably won't notice as much of a weight gain there because there aren't that many cells there to expand to begin with. So that's why you get long-lasting results. So where can we treat with CoolSculpting? I think this is one of the great advantages of CoolSculpting is that through the years, they have developed a lot of applicators that we can really fine tune treatments for people to areas that they want to reduce. So the chin, we'll start from the top. So chin, you can get a nice reduction in that fat pad under the chin. The other thing that with CoolSculpting is FDA showing that you actually get some skin tightening in the chin area too, which I think makes a big difference with CoolSculpting. Flanks, sometimes people are like, flanks, what are flanks? It's, the muffin top, the part, your hippiness, the part that hangs over your jeans that, I think a lot of people, me included, don't like so much. Obviously abdomen, that's one of the most common areas we treat. We have a special applicator that goes on the outer thighs because it is a bit of a different surface there. So we have a different applicator called the Smooth that treats that area. We can do inner thighs. We can do kind of the fat pad that you get above your knee. The legs we can really do a lot with. Same with, there's this little area under this woman's tush when we call it the banana roll. So there's this fullness that we can get under the buttock that we have an applicator that fits on really well to help reduce that. And then bra fat, which actually we're going to see a little example of tonight that we're going to take care of for a patient. And lastly, arms. So everyone's got the kind of name for it, whether they call it the bat wing or whatever you want to name it, but we're able to treat it as long as there's a good fat pocket there and also that you have good skin quality. So this is the another diagram from CoolSculpting I like because it shows the areas that you can treat, but also some of their results. We're going to go into our results too here at Windsor Derm because you can show all the pictures you want that were handpicked from CoolSculpting, but I think it's important to see what we're doing here. So the chin for this lady is like out of this world. I think it looks fantastic, and you can get these results with CoolSculpting with the chin. The bottom picture here, you'll see a bra fat. That's the more that you get in the front. We also are able to treat the posterior bra fat, which kind of runs into the back fat area too. And we're going to show examples of that. Abdomen, I think, is probably one of the most common areas. I feel like a lot of people, no matter what they do, we see so many patients, they're like, I lost weight, I've changed my life, and I still got a pooch. So we treat the abdomen a great deal. The lowest picture there is inner thigh, which I think is also a great result. I feel like that's another area too, that even though you do so many leg exercises, you just still get that pocket. The upper arm picture, I think, obviously the picture speaks a million words. It's great results. Back fat, a lot of women, you know, you want to have a nice silhouette on the back. You don't feel very good in dress when you have these kind of pockets. So we're able to really even those out nicely. And same with gentlemen. They don't like a muffin top either. So that lower picture there shows like the flanks, the more of the lower back. That's the banana roll. That banana, sometimes people are like, what the heck's the banana roll? That's the banana roll you'll see there. So, and we have an example of that as well. And then outer thighs, it's sometimes hard to have patience for outer thigh to be a good, you know, that's why a consult is super important to see if you have the right kind of tissue. I hate to use the lingo for the ways that we call these fat pockets, but some people say it's like they're saddlebags. You need to have a little bit of a prominent sort of like kind of pocket on the lateral thigh for the applicator to work. But if you're a good candidate for it, it works awesome. So, all right. Here's the exciting part. Let's do a treatment. So we're going to let people see what it's actually like. We have a patient in the office tonight who we're going to do some back fat. I figure a video is worth a million words. So let's take a look. All right. So I got my team back here. And I'm hoping everyone say hi, team. Hi. All right. So tonight we're treating Crystal. She's got some fat pockets by her kind of like back bra fat that she doesn't like. She's got a dress that she wants to wear soon that she wants to reduce. So that's what we're going to do. So we've marked her out previously just to help with the video to flow here. But we got nice little pocket there. I don't know if we can see, but this is what we're targeting here tonight, guys. All right, let's get rolling. All right, have a seat. So we have Lisa and Danielle. They're our technicians here. We're in the CoolSculpting room. And these are the machines that we're going to do her treatment with. And they're going to get Crystal rolling. And I told Crystal to please be free and speak how it feels and let us know what it's like. It feels cold. So right now we're doing a treatment. So the important thing with CoolSculpting is we want to selectively freeze the parts that we want. We want to freeze the fat cells, but we don't want to hurt the skin. So we take all these kind of precautions and measures to make sure that that doesn't happen. So right now, the first step when we do CoolSculpting is once the skin's prepped and ready to go, we put the applicator on, and that's when there's going to be a vacuum, like a suction feeling, because it's pulling all that tissue in that we want to reduce. Once we see that we have a really good fit, the tissue's in there, we're really filling the cup, we feel like there's no air leaks and it's going to stay put, that's when we go ahead and turn on the cold. And then we'll let Crystal kind of give us the rundown on what that feels like. Like a little suction. I guess that's it. Yeah. Nothing uncomfortable. So when you get your treatments, I tell people bring something to do. These applicators that Crystal's getting tonight, they're 35 minutes. And here at Windsor Derm, we have 2 machines, so we can dual sculpt. So meaning, you know, rather than doing 35 minutes and then do another 35 minutes, she's going to get both areas treated 35 minutes and then be done and ready to go home tonight. We have TV, bring a book, text, have a snack, take a nap. I've seen it all. So do whatever you want to do to pass your time. Sometimes this is just a nice time to have quiet time so you can relax. All right, so she is on. She's 30 seconds into her treatment, and right now she's going to start to feel the cold. The first 3 to 5 minutes, I think patients feel the most kind of intense cold where we're getting down to the appropriate temperature. After that, it kind of goes numb. The cold in itself is almost the anesthetic in that you don't feel anything once it's numb. And then you just kind of, you sit and you relax and wait till your 35 minutes are over. She's not yelling at us. All right, good. So yeah, this is our suite. We have the 2 machines. Again, entertainment. So as you can see, it sounds kind of scary, the idea of getting your fat frozen, but you know, she's chilling and looks pretty comfortable. All right. Good, guys. All right, we're gonna let Crystal keep chilling. Bye, Crystal. All right, guys. So now that we have her chilling, I thought we would we'll look at some of Windsor Derm's pictures, see how we're doing there. So again, we're going to start from the top. So chin. I thought this was a fantastic result. This patient felt really good about it. She felt younger. She had more definition of her face, and she got compliments that she looked great. What did you do? It wasn't something that was like, oh my gosh, she must have had some kind of surgery. It's just, she got good definition of her chin. You can even see down onto her neck, it's firmer. So chins do very, very well. Arms. I love these arms. These arms are fabulous. You can see that real nice reduction, especially as you approach the underarm there. As you get close to the axilla, she had a little bit more of that pooch there. That's gone. So this is one treatment. I think it looks really great. Abdomen. So this guy was fit to begin with, I think. You can see he's got some definition, but he had this lower abdominal pooch that he was not a big fan of. So that's where we were able to put the applicators, got it down, reduced, and was happy. Pants fit better. So this guy, I feel like, had a transformation. Like, this is pretty awesome. He kind of targeted a lot of areas. So I put abdomen here, but he also did his flanks as well. So kind of that like back fat area. But we targeted the fullness that he had, obviously below his belly button, where he had a little bit more tissue and fat tissue that was hanging. And then we also did applicators above his belly button to kind of smooth down that upper abdomen that he had. And he was super pleased. And people ask about weight and like, how much did this guy's weight change? So with CoolSculpting, this is a body contouring fat reduction treatment. This is not a weight loss plan. So if you were to hold a pound of fat in your hands, it's taking up a good amount of volume, even though it's not weighing that much. So patients with CoolSculpting, you may drop a few pounds. I think this gentleman, it was maybe like 5 pounds. But, I tell people, when we do this, we keep track of your weight. Obviously, we want to see if you gained or you lost, but the proof is in the pictures, and it's seeing how your body changes. So again, I put abdomen here because obviously you can see the really great change she has in her abdomen, but this patient also addressed other areas that I think you can probably appreciate in the picture. So obviously the area around her belly button and like the pooch she has on her sides look awesome. She also did her lateral thighs. So you can see that she was a bit more kind of hippie there on the lateral kind of outer thighs. And this picture I didn't pick it for the inner thighs, but you can also see that she got reduction in her inner thighs. The next picture is the same patient. She went on to do her flanks. So she hated her muffin top. And I think you can see just how much smoother her shape is on her lower flanks. Like, she was excited, and I don't blame her because I think it looks awesome. Guys want to be smooth too. So here's a gentleman. You can especially appreciate he's fuller down there as you get to like the waistband where his underwear and the shorts are sitting. So I think gentlemen like to have this nice streamlined broad shoulders and narrow back, and I think he achieved it. He looks great. This patient, I like this because you watch the commercials for CoolSculpting and they have supermodels. And that can be a little frustrating for a lot of patients. This patient wanted to feel better in her clothes. She didn't want to feel so full. And we told her going into it, we're going to be able to reduce this, but it's not like we're going to get you down to size 0. And she's like, you know what? I just want to feel comfortable in my skin again. And I think this is amazing, but especially like the upper back bra fat area and then down to her flanks. This is a totally different, posterior back. This is great. And this is another example of that bra fat. So she had it kind of lowered down. So when she had her bra on, she just felt she had this kind of pooch underneath her bra. Applicators that we have that are just perfectly sized, that they go right on, really cup that fat and treat it well. Outer thighs. So again, these patients sometimes are a little tricky because people feel like they have fullness, but it's not a pocket. CoolSculpting, you really need to target pockets. So she had this great lateral thigh pocket here that we treated. with the smooth applicator. That one's a little longer than what Crystal's doing tonight. It's a 75-minute applicator. There's no suction, so it's on a little bit longer, but she was very pleased with how her thighs did. This patient did kind of the circumferential treatment of her legs. So she wanted to smooth out the lateral thigh, but she also did her inner thigh. She had more kind of bulk there on the upper inner thigh. So she just wanted a thinner leg altogether. And I think you can really appreciate, she's got a much smaller leg. If you were to, I'm sure if she measured her thigh, it would be smaller, but you can just appreciate the difference. She was happy. And this is the banana roll. So if you look, it's this little pocket that's kind of right below the end of the buttock where it kind of pooches out. So rather than having just a streamlined look underneath the buttock, people have these kind of like rolls underneath the buttock, and that's what the banana roll is targeting. And we have applicators that are a good length to cover that whole kind of banana roll to treat the whole area. So again, that's the beauty of CoolSculpting. We have so many applicators and so many sizes because everybody's different. Nobody's the same size. Everyone, my broth that's different than Crystal's versus someone else's, so we can really customize it. All right, so you see all these pictures and you're probably like, okay, so can I do it? The best way to find out is to do a consultation. We need to see your fat. We need to feel it. We want to make sure it's subcutaneous, which means we can grab it and grip it and get into the applicator versus visceral where it's under the muscular wall. So we need to make sure that you're a good candidate and that, your goals and our goals for you are the same and that we can get you to that place. Consultations are free. We want to see you and just see if we can help you out. Consultations, in the world of COVID now, obviously we're happy to see in the office, and I think that's great because we can kind of grip it and grab it more, but virtually too, we can get an appreciation, one, of what you want to get rid of, and two, is this someone who's going to need more than a couple applicators or less, and that way you can kind of get a sense of, is this something for you? Lastly, I'll say, Alexa is having a event later this month. I think it's actually next week, where she's doing a CoolSculpting and cosmetic day. So come on in. She'll be happy to talk about CoolSculpting and all the other cosmetic procedures that we have here. And I hope this was helpful, and I hope I didn't destroy it for my first Zoom call. All right. Question, I guess we're doing questions. Hi. All right, questions. All right, first one, is this safe for teens? So as I kind of talked about before, the number of fat cells you're ever going to have is still kind of happening throughout adolescence, which is teenagehood. So I think it's preemptive and premature because you don't even know where your body's going to be. Is this the number of fat cells that you were ever going to have? Are you there yet? Are you not? Maybe later teens, early 20s patients we have treated where they feel like their body has they've fully developed and things have been the same. But I'm always cautious about it because, again, you're still developing. You're still an adolescent in my mind, and your body's still changing. So hopefully that helps. Can this do anything for cellulite? I'm not going to lie, no. I wish. If you have the magic cure on that one, sign me up because we're going to put it on my legs. The last patient, well, close to the last picture that I showed of the patient who did her inner thighs and outer thighs, I do think visually and aesthetically, she had a nicer looking leg in that she was firmer and she had a smoother contour, and I think that's going to help. But again, this isn't really a cellulite treatment. This is more of a fat reduction treatment. So, yeah. And then the question was, will this change my weight? So I think we talked about that before. This is not a weight reduction procedure. This is strictly a body contouring fat reduction procedure. So that's what we're really trying to target with CoolSculpting. So we take weights pre and post because we want to keep track. We want to see, but by no means are we, telling folks that you're going to drop 10 pounds, and because that's really not what this procedure is for. If it hurts, can you numb the area? Well, I'm not sure if the patient's question means like afterwards or, so what happens is, so during the procedure, like I was saying, the first few minutes, yeah, it's going to be cold, so it's a little stingy, but then it does go numb. So actually during the time that you're, if Crystal, could hear me through the door, she'd probably say, yeah, at this point, things are pretty numb. After your treatment too, the areas that you treat, you're going to feel numb for a couple weeks. I tell everyone, don't sweat it, don't worry, this is normal. That all returns back to normal. So afterwards, discomfort wise, some patients can feel a little sore for a couple of days. They're going to experience that numbness. They might feel a little swollen because those fat cells are acutely frozen. They've been injured, they've been killed. So it's going to cause that sort of change. But typically afterwards, it doesn't require a lot of pain management. And I'm getting my questions taken away. So right fat or wrong fat. So good fat to treat. People laugh at me when I do a consult and I say, you got good fat. Good fat is subcutaneous fat. Subcutaneous fat is the fat you can grip, you can put it in your hands, you can jiggle it. It's outside of the muscular wall. And then there's visceral fat. Visceral fat is under the muscular wall. It's the weight that's not good for you, for sure. It's the weight that you want to get down because it does have more health sequelae for sure. But we can't treat that with CoolSculpting. So sometimes when someone comes in, especially for their abdomen, they have a round shape and we go to examine, but when we grab, there's nothing to grab. And that's because it's all visceral. And that unfortunately is just old school diet and exercise to get rid of that. Okay. Oh, how long does it last for CoolSculpting? So again, as long as you continue to live a healthy lifestyle, these are results forever. So, because again, you can't make new fat cells. Once they're gone, they're gone. The ones I leave you with after the treatment, if you're not healthy and you gain weight, they can expand again. You're going to have a smaller percentage. Say if you treated your outer thigh, you're going to have a smaller percentage there to fill up with fat cells again. But certainly you can still put weight back on if you don't live a healthy lifestyle. And that's why you need to kind of use this as a way, if I'm going to do this and I'm going to make myself feel better and target these areas, then, make it a good time to make good life choices too and live well. All right. From consultation to schedule the procedure, what is the wait time? It depends. The consultations we can do generally very quickly. So if you wanted to come in tomorrow, you could. Depending on your treatment plan, depending on what you're treating, determines how much time it's going to take. Some applicators are longer, some are shorter. If you have to do, 2 for your abdomen versus 4, that's all going to dictate how much time. But generally, you can get in if you wanted to do your treatment the next week or 2. That's totally doable. And then now is a good time actually, because like I said, you can see results 4 to 6 weeks. Right now, 12 weeks is getting you to like Memorial Day. So that's time for beach wear. And so right now, this is, if you want summer results, then this is kind of the time to get after it. So in terms of cost, that I always like, someone asked about like kind of cost examples. That can vary so tremendously depending on what you're doing. So abdomens, someone always says, well, how long it would cost to treat my abdomen? One, is it you just want to treat your lower abdomen? Do you want to treat your upper? Do you want to treat your flanks too? Because that's your whole waistline. So that's when, again, consults are really key to figuring out whether to get you the appropriate cost quote on that one. So I don't want to give you a number and be like, well, you said this, but it's because you need a different applicator. So that's why consult's really key. And that we also are doing virtual consults. So I get a lot of folks now, you may not be comfortable coming in, and I can appreciate that. So it can be done, again, virtually through our electronic medical record we have. We can do a web kind of visit too. I will say, back to your pricing question, whoever asked that, we do consult days, and those do give perks for people in terms of discounted pricing. So if it's something that you were thinking about, that there is reduced pricing for consult days, which the next one coming up is Alexa. Is there a limit on the number of cycles you can receive in a day? Yes, I will say, because it's, you know, your comfort level of how long you want to sit in the chair and hang out with us, you know, depending on what you do and how many you do. It's up to the person's comfort level. Some people rather split it up just because, you know, they have their mornings free. So we'll do your abdomen in the morning and then we'll bring you back another day and do your flanks that day. Again, a lot of that's sometimes dictated by your schedule. Myself, I get, you know, one day a week to kind of get things done. So for me, I'd be a lady who'd be like, all right, I'm getting it done today. We're going to get it done. So, oh, it says less than 1 minute. Am I going to get logged off? Okay. All right. I think I'm supposed to wrap up. I talk too much. I hope this was helpful and that the pictures help kind of give a sense of what CoolSculpting can do for you. And if you want to consult or if you have questions, we have Danielle and Lisa who are great at fielding those too. So give us a call and we're happy to help. All right, guys, have a great night. Take care. Stay well.